Greetings all. Today we are going to see mudras to prevent COVID and mudras to perform in the COVID and post-COVID conditions. Just we are going to see very effective 5 mudras. The first one is it will increase our immunity. The first one is the Prithvi mudra. How you are going to perform this mudra is you are going to touch the tip of the thumb and ring finger like this, and with your palm facing upwards you are going to keep your hand like this. So you can perform this mudra from starting from 5 minutes to 20 minutes at least 2 to 4 times a day, so that you will be immune against any type of viral disorders, whether it may be COVID or any other fevers or any other cold flu, common cold flu, etc. What does this mudra do is it balances all the deficiencies in our body. So if you start performing this mudra, you get your energy bumped up like anything. So in the COVID conditions also, when you feel very tired in the fever, you can perform this mudra. The second mudra is the mudra for throat. The main thing in this viral infection, it enters the nose and then throat, and it causes a throat pain and also a dry cough. In this condition, what is the mudra you are going to do is called Pranavyana mudra. Fold your index and middle finger and going to touch the tips of the thumb, little finger and also the ring finger. In this position, if you start doing the mudra, you will just immediately feel an activity in the throat, so that the throat will get cleared. You can be out of the dry cough. If you are having throat infection or dry cough, anything like that, you can perform this mudra starting from 5 minutes to 10 minutes to n number of times a day. You can do any number of time. If you are having a severe throat pain, you can do it continuously for 5 to 10 times a day, splitting up into 10 minutes, 10 minutes, 10 minutes like that. Then the very important mudra I am going to teach you is the Linga mudra. It's tested and proven, and we have conducted a test with equipments like thermal imaging camera like that. It increases our heat in the nasal part, throat part and also in the lungs and chest part. So whenever the heat in the spots are getting increased, you know, when the viral load in the place are getting relieved. So how you are going to perform this mudra is, you can perform this mudra in the conditions what you when you need immunity, and also in the COVID conditions and also in the post-COVID conditions. It's a very important thing. The great secret is in only one nostril your breath will be going on and the other nostril will be blocked. You just see in which nostril. Now I am seeing me. So my right nostril is blocked. So I am getting the thumbs up in the right hand. Then I am going to lock this right thumb like this and also clutch both the hand like this, so that I am forming a tight fist. There is no air entering into my palm. So you are going to hold the hand very tightly with my right side thumb up. If I have no airflow in the right side, I am going to do it with the right thumb, and if I am not having a airflow in the left, I am going to do it with the left thumb up. Now I will show you the position. Like this you are going to do. You are going to make a tight fist. What are all the uses the mudra is going to do is, it will reduce your fever. It has been proven with so many patients that their temperature is going beyond 102 and 103. When you start doing this mudra, you will start getting sweat and your temperature is reduced. It may be performed starting from 5 minutes even to 40 minutes. So that in this pandemic condition, and who are all affected by COVID and bedridden or taking rest or isolated, you can perform this mudra any times, and duration is not a restriction. So you will get reduced of the fever, number one, and number two, the phlegm in your lungs. You feel like the phlegm in your lungs comes out. The kaba or phlegm in your lungs comes out, number two. And number three, the O2 level is getting increased. It's not a temporary phenomena. If you do any type of positions or pranayama or yoga, your O2 level, your oxygen level, SpO2, you would have been reading your O2 by pulse oximeter, your oxygen level will get increased by just 1 or 2. If you are having 96 O2, SpO2, it will be increased to 97 or 98. But after half an hour, it will come down. But while performing this mudra, if the O2 level is getting increased, it is maintained for more than 4 to 5 hours. So You start doing this very, very simple Linga Mudra any time of the day and in any position. You may be flatly lying on the bed, you may be sitting, or you may be leaning behind in a chair. You can do this mudra in any position for any time. The limit is when you get sweat, you can stop this mudra. It is very, very effective. So I want to convey this mudra to you. Then another important mudra is Prana Mudra. How you are going to perform this? You are going to touch the fingers, 3 fingertips. Thumbs must touch the ring finger and the little fingertip. In any position you can do. Just you hold this position in both your hands all round the day. Because as you get very tired because of this fever, you can also recover very quickly from the fever. So you are doing this Prana Mudra so that you can maintain your energy up. Then last but not least mudra is the very, very important symptom in this COVID is it affects the heart. Most of the persons are getting a heart attack or hemiplegia, like that things, because the blood becomes thick. So what's the mudra you are going to do is the heart mudra. Very, very simple but very, very effective. If you feel a pain or uneasiness in your chest on the left side or left hand or little finger or in the side of the jaw, you can start doing this mudra. For safe side, you can also perform this mudra after you have come out of this COVID infection. Very simple. You are going to bend your index finger and keep it below the thumb. The next 2 fingers, that is the ring finger and the middle finger, you are going to touch the tip of the thumb, and the little finger will be straight. You can do it for starting from 5 minutes to 20 minutes, at least twice a day. So we have learned 5 mudras today, which will, all the 5 mudras will be very, very effective in the COVID conditions and the conditions in the pandemic conditions to get the immunity, and also in the post-COVID conditions. So I am consolidating all the mudras. First of all, we saw this Prithvi mudra to increase your immunity and get out of the tiredness what you are having in the conditions of fever and before fever. Then the next one is, we have seen the Prana Vyana mudra. We must fold the index finger and the middle and keep the 3 tip of the fingers like this. We are doing this for our throat. Next, the very important mudra in all the conditions, before, after and at the time of COVID, is the Linga mudra. We to perform seeing your breath, in which nostril you are not having the breath, to thumbs up that. Then we are to clutch your fingers like this and going to perform this Linga mudra and get rid of your fever, your phlegm. And very, very important, in this pandemic condition, the O2 level is getting down for everybody. So to maintain your oxygen level high, you just start doing this mudra today itself, like this Linga mudra. Fourth, we have seen the mudra Prana mudra, which keeps your energy always up. Then last but not least, the heart mudra. It is also called Mrityunjay mudra, which will save your life, which protects your heart, like this. Index finger bend, then the tips of the 3 fingers, and then the little finger is raised up. So by performing this very, very simple 5 mudras, we are having too many testimonies of our patients with the Siddha or Ayurveda or homeo medicines. You can do this mudra, and if you are admitted in the hospital or if you are taking allopathy medicines, along with that also you can do all these mudras to get rid of this deadly COVID symptom and come out of that. Thank you, friends.